Perspectives, views on diversity. What does diversity mean to you?
Range of experiences and people and ideas and information coming from everyone from every walk of life and coming into this sort of melting pot of life, it's kind of the essence of what it means to be human. It's what makes us all different is what makes us all the same, and when we recognize that, it's just a pretty awesome thing.
Diversity means, that's definitely a pretty complex question, but it just means having the privilege to meet people that are different from you in every possible way. Because we know that, at least it enhances me as a person, and I know it's the same for like pretty much most people, but at least for me it's the privilege of being able to understand people better when you can actually talk to them and see exactly how different they are from you.
Oh, diversity means looking at all sides, all angles, all views of the situation, trying to make the best of it.
Well, I have a definition for diversity, and that is that it's the normative condition of human existence. And by that I mean that every human being is different, and we differ in multitudes of ways, not just based on skin color, gender, or sex, the most obvious things. We differ in terms of age and education and health and wellness, height, languages that we speak or don't speak. So diversity exists all the way down to the level of individual. Every family is diverse, every community is diverse, every nation is diverse.
So diversity actually means to me, it's not necessarily from a racial standpoint. For me, it's more about the background and also the different experiences that one brings to the table, as well as the knowledge and skills that one can contribute to the overall team environment.
Because I'm a counselor, I always think in terms of human beings. So diversity to me means that you have students or people with different backgrounds, different ethnicities, all working together for the same purpose. Or they're in the same place for the same purpose, whether it's a church or a school or what have you.
Well, for me, diversity is really everything. I went to a very diverse high school, and so I never really realized how important it was to me until I went away to college in a much less diverse area and realized I was so lucky where I went to school first, because I went to school in Louisville, where it was really diverse. I went to a more rural college, and now that I'm back in Louisville, I'm really appreciating how diverse it is, and it's just so much more refreshing to be around different people.
Is diversity important in providing good health care?
I think it's absolutely essential.
Absolutely. I don't know how you could provide healthcare without knowing about it, just because we may be accustomed to treating as, I guess, future physicians, a certain group of people, but we have to know that our goal is to help everyone, which would mean everyone would be really different.
We have to be conscious of everyone's beliefs and traditions and ways of life in order to be effective doctors in such a global, medical field.
Let's say that I believe very strongly that being knowledgeable about human differences and that we're all different is vital to providing good, equitable health care. Diversity in the sense of having a diverse workforce is important, but I think that we have to focus on the knowledge and skill sets that are needed to provide competent health care. And having the cultural competency to do that is where the focus needs to be. Certainly we need to have equity in terms of hiring and admissions in medical school and all of that. But you can diversify your population, so to speak, and still not provide culturally competent health care if people aren't educated in terms of understanding what diversity really means in our community.
I absolutely think that diversity is important because it causes people to see things from a different vantage and appreciate different cultures and appreciate different walks of life, different socioeconomic statuses, and cater to that. So by being diverse, you're being more open-minded to these things.
I think it's absolutely necessary because there is such, for people that are in minority groups, and in Louisville that is primarily, traditionally been African Americans, but that's changing. I think it's very difficult for people of a minority background to find a healthcare provider who looks like them, or who, by nature of what they do, has unique opportunity to know the background and the culture of their patients. So, yeah, I think it's very important. We all should be able to have that ability to choose a physician who looks like us or understands us in a unique way. And that does not exist right now.
Absolutely. I mean, everybody's different, just like I said. There's just like no one patient has the same amount of teeth in their mouth. It's the exact same with people and their life experiences and how they're going to interpret anything they say to you and anything you do. And if you don't know how to communicate with a wide range of people and perspectives and the like, you're not going to be very successful at what you do.
How do you contribute to the diversity at U of L?
I think about being as inclusive in the services that I provide as I can be. I'm here to do academic support, and I do recognize that not all students come here on a level playing field, and that could be because of socioeconomic differences, could be because English is not their native language, could be any number of things, but it's my job to help those students get to the level playing field.
I got cool hair. I mean,
So funny.
I don't know. The only way you can really do it and know you're doing it is just sort of being yourself. Because when you try to be somebody else, that's now there's two of that person, none of you.
From the outside, probably not. Most people wouldn't think I'm very diverse. I'm a middle-class white guy from Jefferson County. But when you get to know me, I'm actually probably one of the most unique people you've ever met. I was raised Jewish by my father. My mom is Muslim. She used to be Catholic. So sometimes I consider myself Jew-Muslim. I'm also openly gay, so that's like kind of the, not trifecta because that's four things, but whatever that would be called.
Yeah.
I gave a facetious answer to this question earlier where I said I contribute by breathing. And by that I mean that, I'm representative of human diversity, and a walking, living, breathing example of it. I'm described as a tall African-American male of a certain age, which I won't recite at this point. I have a mustache. I have a graduate school education, a couple of graduate degrees. There are many things that distinguish me as an individual, and I think that pretty much answers that question.
So I feel like I have a different background than most of the other students, and now also many of the other residents and interns. I think that most of my background is quite unique in the sense that I bring about 15 years of other experiences outside of medicine. A lot of it comes from the business world that I'll hopefully be able to help from an administrative standpoint moving forward in the healthcare environment.
I feel like I can just contribute to the diversity here by just being who I naturally am. Like I do have, my family is not from this country, they're from Nigeria, so I guess that part is also ingrained in me. But I guess just through my circumstances and the things I've gone through in life, it makes me a unique person anyway. And so when I come across people at U of L who are different from me, which is pretty much everyone, like I feel like I contribute because I know that we do think differently on certain things, whether it's due to experience or upbringing, that I can bring to U of L.
I feel like I contribute to diversity at U of L by bringing a different viewpoint of my profession that I want to go into, specifically public health, and how that integrates with all the other health science campuses like med, dental, nursing, and just providing a different viewpoint, diverse.
Now some quick facts.